Our experienced technologists are trained in the specialized field of bone density and certified by national agencies. Our bone density technology continues to be the gold standard in measuring bone mineral density. Bone density testing measures your risk for osteoporosis and bone health. This is an X-ray that involves scanning the spine, the hip, and sometimes the forearm. Bone density scans are generally done after age 50 and after a woman goes through menopause. The test can be done for patients who have had radiation and chemotherapy, as well as patients with a history of anorexia and bulimia. You can expect to lie on the scanning table, usually fully clothed, for 15 to 20 minutes while the machine scans your spine and hip. Forearm scans are done while sitting in a chair. There is no preparation necessary to do this test. You don't even have to hold your breath. The results of your bone density test will place you into one of three categories: normal, osteopenia, when bone mineral density is lower than normal but not yet osteoporosis, and osteoporosis, which is a disease of bones that leads to an increased risk of fracture. Our scans are interpreted by two physicians within our practice. The results are reviewed by the ordering physician and relayed to you by a letter, a phone call, or message through our patient portal. A follow-up scan in 5 years will be recommended if you have a normal scan. If your scan is in the osteopenia or osteoporosis range, then follow-up in 2 to 3 years is generally recommended. Osteoporosis is not a natural part of aging. It is often called a silent disease because you can't always see or feel its effects. The first sign, in fact, may be a broken bone. Your risk for osteoporosis may be higher than you think. Occurrences of osteoporosis-related fractures are higher in women than heart attack, stroke, and breast cancer combined. However, the latest guidelines note that osteoporosis can be prevented. It can be detected and treated before any fracture occurs. Even after the first fracture has occurred, effective treatment options exist to reduce the risk for additional fractures. It's never too late to make lifestyle changes to help keep your bones strong. Let's talk a little about what you can do to keep your bones strong and healthy. Making lifestyle changes with diet and exercise can play key roles in helping reduce bone loss. Calcium is the most important mineral for bone mass. Proper intake of vitamin D helps your body absorb calcium and other minerals essential for bone health. We recommend 1,200 milligrams of calcium and 1,000 units of vitamin D daily. Exercise is also important in maintaining strong bones, improving balance, and decreasing the risk of fractures. Weight-bearing exercises such as walking, hiking, and dancing are all good choices. Push-ups or other arm strengthening exercises are also important. Most insurance companies cover a bone density after a certain age. You would need to call your specific insurance carrier to find out if they cover and how they will pay. The insurance will ask for the procedure code, which is 77080. Please keep in mind that they might pay differently for a screening versus a diagnostic bone density. If you have been diagnosed with osteopenia or osteoporosis, your bone density will be coded as a diagnostic test from that time forward.